Okay. So there are no financial interests. I think all the speakers, on behalf of them, I will vouch this, that there's no financial interest in talking about these products. Now we are talking about Optos Daytona. I am using this instrument. Daytona is an equipment which doesn't have ICG and FFA. It's pure color, and software-wise you can convert into Redfree as well as choroidal imaging. And additionally, you can take one more scan which gives you autofluorescence. A very small foothold of the machine. On this iPad, like you can put in the data of the patient. This is the server, and you have the display here. A very compact thing. So a patient is placed here, and through this peephole-like thing, he peeps into the machine. There is an ellipsoid mirror there, which captures the images within a few seconds. There is in that bowl, he sees this very well-defined marker. And as soon as he sees this blue, he is too close to the machine. He has to butt in the green position. Red is too far off. So as soon as he sees this in sharp, the photo is taken within a second. So this is what type of imaging you see within a few seconds. Can I dim the lights a bit? So now, in very short, what is the principle? It has an ellipsoid mirror with two focal points. The first focal point acts as a pathway for laser to focus on the retina, and the second focal point allows the coincidental focusing of the patient's eye. The resolution is about 20 microns on axis and 40 microns off axis. It utilizes two lasers, the green laser of 532 nanometers and red of 635. The machine enhances the retinal images using the two laser wavelengths to magnify and separate different layers into color components, but these are pseudo colors. The green, as you know, penetrates in the upper layers of the retina, whereas the red penetrates to deeper layers and can be separated. Now, the principle is that they create a focal point just behind the iris, and then the laser pivots around it, so you get a very wide field of capture on the eye. And these images are from the inside of the eye. And very shortly, the key benefits: you get 200 degrees or almost 80% of retinal view in a few seconds, almost instant display on the monitor screen, and software can toggle between the Redfree and choroidal images. All this is on cloud storage, so that you don't have to bother about the images you take, because all images of our high data, and it reduces the in and out time of the patient. So let's look at the images now. This is a standard color image which you get while screening the patients, and this is a standard Redfree you get. This is just in the software you have to check. You don't have to take a separate image for this. And this is the choroidal imaging. You get autofluorescence, and the resolution is so good that even if you magnify it 10 times, the resolution doesn't go down. More about this will be from Dr. Anand. Now, usually we take a straight ahead image, but if you want to go to the periphery, you can still have, within a few seconds, you can do an up gaze, a down gaze, a left gaze, and a right gaze, and the machine immediately gives you a collage and gives you a montage where, as you compare with the standard image, like you can see this vessel here you can see still more. So from 200 degree, you can go almost up to 220, 230 degrees after the montage occurs. Now, as you can see here, many a times you may see some lashes coming in between, but with high myopes and with little tricks by the person who takes the image, you can almost get 220, 230 degrees without any lashes coming in. Now, what's the use of having these extra images? You can see here we are taking a lower gaze image, and it's a small atrophic hole, and the snail track degeneration is well seen, and you don't miss them. You can see a peripheral retinal break with small fluid cuff very well. A retinal detachment partial RD. I've just blown up this image, and you can see a break here. And not only that, next day when the patient comes for a post-op visit, first post-op, you can immediately get a very clear image, see that retina is attached, breaks are well on the buccal, cryo is there, there's an air bubble here, retina is flat, macula is flat, and 1 month down the line again. So following up this patient with wide field becomes very easy. You get excellent images, and you can see if we have not missed any thing. Now, just to give in perspective how this technology is useful, this is just 2 days back this patient came to me. On clinical examination, I noticed that there is probably an NVD here. So I asked for an FA. This is on my own machine, but a new technician, pupil not well dilating, there's little cataract. So you see the quality of the image, you just can't make out anything. But we did an FFA, so we were sure that there is NVD. Now look at the Optos image. Here you can see NVD, venous loops, some hemorrhages here, cataract. Blow up this image, this NVD becomes prominent, but you do a Redfree, very prominent. So with this, you don't have to even do an FA in such patients. You can straightway document this and start the laser treatment if you want. Now, if you have this something like non-ischemic CRVO, you convert into Redfree, you get a whole thing, and these hemorrhages all well documented. Patient comes for follow-up every month. You just keep repeating it and see how the hemorrhages are clearing. Again, you blow up, you can see NVD, NV, venous loops, IRMAs, all in one shot with the Redfree. Patient treated, you do the same HST as shown you, you just document it. So whenever patient comes back and you have to see how the thing is behaving, you have a good record. Now this patient had multiple breaks, and I had to do an laser, but she was very uncooperative, blinking, moving. So I just finished the laser and I said I'll do an image so that I don't have to see that everything has gone well. And you can make out here that this was missed because the patient was not cooperative. So I said, okay, you can come after a day or two and I'll do the rest of the treatment. So documentation and checking what you are treated has gone well also can be done with this. And again, patient who was not fit for FFA, you did this Redfree, and you could see that NV here, you can document it, and you don't have to do an FA to start the treatment. Similarly, we are doing screening for a general patient who comes for a follow-up, and you see this, you blow up, and you can see that there is a definite ERM there. Or again, patient who came for regular follow-up, you see that there is an laminar macular hole with cellophane. On this patient who had BRVO, had new vessels, underwent laser, but you can see here that this new vessel was persistent even with laser. So we gave an anti-VEGF somewhere around 17th of October, and on 27th November you can see that the NV has gone off. So following up this patient, again you don't have to repeat FFA every time to confirm that whether your treatment has worked or not. A choroidal imaging, the images assist in demarcating things like choroidal detachments. You can see your laser burns which are done earlier, and you can also make out choroidal sclerosis. This is post-PRAB, patient had choroidals. You can take a photograph and then keep following these patients and accordingly manage his treatment. You can see this laser burns. The patient had undergone focal laser a few years back. Clinically, we couldn't see much, but if you do a choroidal imaging of this patient, you can make out each and every burn, so you know whether you have to give some additional treatment or not. And similarly for PRP, you can make out how the laser burns have been placed, areas whether this needs filling up, we can decide about that. Again, patient post-trauma, we screen the periphery, but you can see here choroidal tear very well documented. Clinically, choroidal sclerosis, you do a choroidal imaging, you can make out the extent of the choroidal sclerosis. Post-operative follow-up also, image comparison can be done. This is pre-op, young diabetic, she had macular traction, we did surgery under silicone oil, you can see the retina is flat and she's doing well. We can also screen the periphery and note that there was no active break there remaining. Following up the patients on monthly or 6 monthly or yearly basis, you can compare the images of each eye, and we can get 9 images at a time to be compared. As an additional finding, it helps in even documenting cataracts. So you can show to the patient that both eyes, we have done the imaging, that is cataract, and even without pupillary dilatation, you can decide about cataract surgery. This young female had narrow angles, we couldn't dilate her, but she had diabetes for 10 years. So we did her as it is because we wanted to check the periphery, and even the center part showed good changes at the macula, indicating that she had diabetic maculopathy. So again, even with the peripheral screening, it is good to detect the central findings also. Very useful in children. If you just talk to them, play with them, and make them sit on this machine, it's easy to capture their images, and this is what you can get in a young child also. Good retinal images, so we don't have to dilate them, they keep crying and they don't get dilated well. So I found it beneficial as a technology to screen the periphery, to detect changes, to follow them up, to see how your surgeries work. And especially in these situations, it is very useful. Patients who are not tolerant to light, patients who have problems following dilatation, they don't want to get dilated because they have to drive back home. Uncooperative children, patients having contraindications for FFA like pregnancy, renal failure, past allergy, or who just refuse FFA, all suspected narrow angles now, they don't have to wait for me to decide whether this angle is narrow or not, whether the patients can be dilated or not. We can straightway do their Daytona, and then they can come to me, and later on I can decide whether it can be dilated or not if necessary. And all the allergies, people having allergies to dilating drops, we have a problem how we treat them, but at least for the follow-up, we can use Daytona to see how they are doing. And certain basic advantages of the technology, auto capture mode, images are taken instantly, and there are no moving parts. So the just patient holds the machine and sits there, and the image is taken. And it is very easy to train the staff. Within a few cases, the staff is trained, so you don't need a specific technician. You saw how my color photograph came with the machine because the technician was not good. And other advantages that it's higher technology, so you can shift it anywhere you want. You can see now yesterday only I was here, a young patient of mine, one-eyed young child, started complaining she's seeing some black spots. So they called the patient, did a Daytona, sent me on WhatsApp. I could talk to the father immediately. So very good technology to assess patients and counsel them. So to conclude, Optos Daytona is a very good technology, and it's here to stay. It allows comprehensive eye care without compromise. Now, once cheaper version of this or similar technology is available, I think it will be as common an instrument as an auto ref. We just have to wait for that day.